Okay, good afternoon, ladies and gentlemen.
Good afternoon.
Today, I'm going to perform perineal care to a female patient, followed by care of catheter. Of course, we did already the 12 sequence. I don't want to repeat anymore, no? In order not to prolong. So what are the indications of perineal care? The indications of perineal care are to avoid microorganisms, to avoid infection, for patients' comfort and relaxation, and also to avoid foul smell. Okay, so the situation that we have here is a female postpartum who was just delivered, normal spontaneous vaginal delivery. And then she was able to have or have an episiotomy incision. So as we all know, episiotomy incision is a clean surgical incision done by the obstetrician or by the midwife. So therefore, our setup here in the perineal care is two. One is the clean technique and the other one is the sterile technique. And of course, definitely again, the care of catheter is a sterile technique. So the best position of the patient when we do the perineal care is the dorsal recumbent position, and then we're going to cover the patient what we call as the diagonal drape. Diagonal drape, D-R-A-P-E, diagonal drape. So I'm going to move first the patient near to me to avoid overreaching based on the principles of mechanics. So bend your legs, pull the patient, leg to buttocks to head, okay, swing, then buttocks to head, buttocks to legs, 1, 2, 3, swing. Now, assume the patient the dorsal recumbent position, flex or bend the knees, okay, legs apart, then put both arms on the patient's abdomen, so that it will not be exposed to avoid chilling or chilly sensation. Now I'm going to drape my patient with a diagonal drape. So find one tip or end of this is the top sheet. So I'm going to turn this around. Then fold it towards the feet. Then find also the other end of this. They're going to meet at the center. There, the pointed part. They will meet at the center. Now I'm going to cover the legs of the patient to avoid exposure, to avoid chilling, by wrapping the top sheet on the patient's legs. Like, i-wrap ninyo. Or you just let the patient step on the that's the sheet. And then the other one also. And then, wala pa man, cover first to avoid exposure, no? And then you roll towel under the hand of the back. So this is the hand of the back of the patient, no? Roll towel. The purpose of this roll towel is in order to balance the height of the back of the patient and the height of the bedpan, which we're going to insert later on. So again, principles of body mechanics. 1, 2, 3. Go. 1, 2, 3. Flip. Okay. Thank you. Then insert the bedpan. So this is the bedpan class. So there are 4 kinds of bedpan. One is made of this stuff. How do you look at it? Is it stainless? Okay, stainless, enamel, aluminum, and also plastic. So if you're making use of a stainless bedpan, you're going to pour warm water inside and then swirl and then throw it. The purpose of this is that to minimize the coldness of the bed pan. And then you test the temperature. If the pan is not so hot, you might scald the patient. And then when you insert the bed pan, be sure nga iyang batas ganhi. Kaya ganhi man ito i-throw ang urine or mga pieces. This is the dirtiest part of the bed pan. Okay, so we're going to insert it. 1, 2, 3, go. Okay, lift. And then check to the shoot. Okay, adjust. So you notice nga insert it at the side, wala sa center, no? By the way, class, if you encounter this kind of problem in the assessment area, you better let the patient assume the abducted position. I just show you the dorsal recumbent. Mahala na mahirapan ko, no? Anana. And then you wrap the uppermost part of the sheet with towel. Kana, i-wrap na to para dili mabasa. To avoid wetting. And also to help in the opening of the sheet. Ano na siya? Nawa, yung taon. Ano lang, practice na lang guys ha. Okay, may slide magot siya. Nga. Practice na lang, dito. Pwede naman pwede. Yan. So, expose ninyo ang area to be clean. Dapat expose. Tapos na siya ay incontinent pad. Present incontinent pad. Okay. Now we're going to do the initial rinsing of the perineum. So I have here the warm water. So I'm also going to test the warmness of the water, no? Warmness, okay, fine. Then I'm going to pour water. I'm going to start in the mons pubis. This is the mons pubis class. This is the mons pubis, farthest labia majora, nearest labia majora, farthest labia minora, nearest labia minora, farthest groin or inguinal area, nearest groin or inguinal area. This is the farthest inner thigh, nearest inner thigh. Okay? So for mons pubis, then I'm going to be at the center, clitoris, urethra, vagina, anus. No? So mons pubis, farthest labia majora, nearest labia majora, farthest labia minora, nearest labia minora, and then go to the center, clitoris, urethra, vagina, anus. Tapos, farthest groin, nearest groin, okay, farthest inner thigh, nearest inner thigh, okay? Wait na. Now I'm going to apply soap. Okay. Now I'm going to make a mix. So you prepare at least 2 to 3 basins with warm water. Then of course, we make use of soap pad. So this is from the third basin. So water pour, tested, and then soap. So kani ang soap? So soap na siya. Okay, then wash, rinse, soap. Okay, make a mitt. Of course, you do a mitt on top of the basin, not just anywhere to avoid wetting around or mess. Okay, so this is square mitt. Okay, we start with the mons pubis. Mons pubis, farthest labia majora. Farthest labia majora, ha? Then use the other side of the washcloth. Mons pubis, nearest labia majora. Okay, wash, rinse. Okay, so wash, rinse soap na ba ni siya? Wash, rinse soap. Farthest labia minora. Kaning gamay ha? Nearest labia minora, other side. Wash, rinse soap. Farthest groin, other side, nearest groin. Wash, rinse soap. Farthest inner thigh, zigzag stroke. Nearest inner thigh, zigzag stroke. Okay? And then we're now going to proceed to sterile technique. So we're done with the external part of the perineum. Now we're going to clean the center using the sterile technique. So dapat na ni additional pad or additional towel. So na naman siya incontinent pad, you can put it here. So everything should be padded class, no? To avoid additional soiling o puan ba? Additional work. Okay, na. Of course, before you do the sterile rubbing technique, I will transfer cotton balls Kani sterile, kani waste set ako. So, i-transfer na ako. Okay, then you replace. Then you cover immediately. Then you also open na the sterile OS. Kani siya class, when you open sterile gloves ha. So of course, I have checked the expiry date, no, and the integrity. Then very unsafe man, it's going to pick this using my gloves because it's still clean. So I'm going to make use of a pick-up forceps. Then put it at the one side of the kidney basin. No? Replace. Okay. Now I'm ready to do the sterile glove technique. So ready na po, ready na. Okay. So this is my sterile gloves. Glove to gloves. Skin to skin. Then overlap with this card. Then, so the sink is quite far, so I just did the hand sanitizing of my hand. Now I already checked the integrity, expiry date, any discoloration, any insect bites. Now thumbs out. Wrap. Then you fix the flap, the cuff of the cotton. Okay. So define the flap. So we should apply powder, no, para mo-slip ang gloves. Yeah. Okay, this is my dominant hand, non-dominant hand. So I first put on the gloves in my dominant hand. Okay. Hold only the outside part of the cup. Then explore or look for the fingers. Explore the fingers. Then I'm going to protect my glove hand by inserting it inside the cup. Okay. Thumbs up. Explore the fingers. Then you cover this one here without touching your arm. Then you fix glove to glove. Okay. Now I'm going to pick transfer. So this is cotton balls with soap suds, and then I have here the OS or gauze for cutting dry, sterile. Okay, this is my dominant hand, non-dominant hand. Pick transfer. Clitoris, urethra, vagina. Wrap. Pick transfer. Clitoris, urethra, vagina. Wrap. Pick transfer. Clitoris, urethra, vagina, anus, gluteal folds. Okay, then wrap. Pick, transfer, anus, gluteal folds, and buttocks. Okay, you now clean. Then I'm done. I'm now going to pour with lukewarm water. Okay, this is my contaminated hand. This is my remaining sterile glove hand. Okay, so I'm going to hold the picture. This one. Pagani glasses ni mo na yana ha. Okay, ayaw hold. Then I'm going now to rinse. Starting from the mons pubis, then farthest labia majora, nearest labia majora, farthest labia minora, nearest labia minora. Then you go to the mons pubis, then you go to the center again. Then farthest groin, nearest groin, farthest inner thigh, nearest inner thigh. Then if you want to go again to the center, center. Para ma-rinse ang soap. Now I'm going to pat dry. Using my sterile hand. Okay? So, I'm going to pat dry first the center. Clitoris, urethra, vagina. Turn. Farthest labia minora, nearest labia minora. Okay, you can turn or you can use another pads, no, sterile pads if you have plenty. Then you go now to the farthest labia majora, pat dry, nearest labia majora. Then mons pubis, zigzag stroke going up. Na? And then farthest groin, nearest groin, farthest inner thigh, zigzag stroke, nearest inner thigh, zigzag stroke. Then another OS, then anus, buttocks, gluteal folds last. Then you discard. Okay? So I told you that the patient has underwent a normal spontaneous vaginal delivery with episiotomy wound lateral. So the incision is here. So using forceps, now this time there's already cotton balls here with betadine. Betadine na niya is not so. Using forceps, I'm already unsterile, no? So pick up forceps. So the forceps the one sterile. I'm going to paint the episiotomy wound with cotton balls with betadine here. Okay. But at least 3 times. Okay, so at least 3 times na. Okay, done. Now I'm going to proceed with catheter care. So this is the Eurobag, no? Kanang collection sa urine. Ato lang, catheter ato kinahanglan, okay? So presuming that this has been inserted at the urethra of the patient, no? So we don't do catheterization the in situ, but we do the catheter care. So kani inserted na nisa sa urethra. Okay. Tapos agatong Eurobag, sumpay kanto pa dong. Wala na, di na nato. Okay. So, prepare all the materials, cotton balls, sterile cotton balls, then you pour betadine. Then, I have changed with a new set of sterile gloves. Okay, I have changed with a new set of sterile gloves. Then I pick 2. The one hand is going to hold, the fingers will hold the insertion site to avoid pulling of the catheter while you clean it. Then you clean in a rotatory motion, single stroke, go at least 2/3 high. Okay, clean the catheter in a rotatory motion, at least 2/3 high in a single stroke. When you say single stroke, you don't go back to the insertion site, then you drop, then another. Okay, hold the insertion site, clean in a rotatory motion, the rotatory motion, single stroke, at least 2/3 high, at least 3 times. Then, you're going to squeeze the cotton balls in the insertion site for the betadine to enter the urethra. Okay, then you squeeze. Do not squeeze the clitoris, ha? It's only the cotton balls that you're going to squeeze. So, kita na. Then, it's start. Okay, I'm done. So, put patient comfortably on bed. So, remove everything after here.